Good morning, everyone. I would like to present on behalf of our delegation from Vietnam Medical Association. So, in my presentation, it will be 3 points. Number one is the Vietnam Medical Association is institutional updates. We cannot update everything, but some. The mainly our presentation is to the scientific report on the topic of our meeting today, that mental health burden among the healthcare workers in Vietnam. And the last but very important is future priorities, is strategic direction for Vietnam and also for our region. So first is the VMA at a glance. We have long-standing history with the 70 year, as you know, and we have a core function pillar. Majority is a policy consultation. It's very important. You cannot list here in details. Advocacy, in conjunction with the Ministry of Health. CME is very important for every physician. Scientific publishing, and the national, regional professional cooperation to improve our goal is a community health outcome. This slide showing the system of the VMA. In the top, we see that we have conjunction with the Ministry of Health. It is very important for all our activity to make the policy advocacy. And we have 10 institutes and the center making their own activity. We have a member, organization member, with the 59 national specialty association. For example, Vietnam Lung Association, Vietnam Heart Association, and so on. At the local medical association, we have 33. Last time, we have more, but now it's a reform of administrative. The major achievement in last year, we celebrate anniversary 70 year with the legacy of the service to Vietnamese medicine. It is a majority activity of our association. We achieved a state honor. We received the first class labor medal awarded by the President of Vietnam for exceptional contribution. Unity. We strengthen coordination. Thank you very much. We strengthen the coordination with the Ministry of Health, as we said before, and expanded member association nationwide. We try to make our unity bigger. There is a picture of the 70th anniversary celebration in Vietnam of the Medical Association and received the National First Class Labor Medal. And this Vice President of Vietnam. And very pleasure we have Madam Chair, President of our MASEAN give a speech. And also the General Secretary also give speech. We very honored to you and thank you again, once again. For publishing, we have Vietnam Medical Journal. It's a long-standing history as well. Last year, Vietnam Medical Journal in the Vietnamese edition was edited, published, and distributed at the frequency of the 2 and 3 issues per month. It is quite a big burden, but we try to make the quality better. The scientific regional engagement. Number one is every year we have annual conference, and last year on the topic research and application in medicine. And the second, we co-organized 13 international conference and conducted 12 major scientific workshops and CME updates. And we also active in the MASEAN group of journal structure. On the picture, we have a small, but Professor Huân, Professor Phối, and myself and the other leader of our association. This is a picture of the scientific conference. And this picture shows you the concept of the tradition. Here you can see that we say the respecting senior, and later we nurturing the future. That meeting the top scoring new student in medicine and pharmacy. It's our president, Professor Chuyên. Today it cannot come with us. And this is we go further. And we have recognition from the Prime Minister and recognition of the Vice President of Vietnam and Minister of Health and other relevant. So we go to the scientific part. It's mental health among healthcare workers in Vietnam today. Current evidence and strategic response. Why is this topic? We are here in the MASEAN meeting today with the topic is mental health and climate science. So mental health among healthcare workers is no longer only the welfare issue. It is the workforce issue, a patient safety issue, and a health system resilient issue. It's an overview of global and ASEAN context. WHO states that at least 25 to 1/4 of healthcare workers reported anxiety, depression, and burnout. Psychologically, risks are real occupational risks in the medicine or as a health. Asia also face a workforce shortage as we see the number of the country. Aging population, rising NCD, burden, increasing the service demand, and mental health of healthcare workers is an indicator of the workforce resilience. It is really. This is we sum up with about 7 studies relating to mental health among healthcare workers. And we saw that within the COVID-19 pandemic, we see more or less 50% of the depression and anxiety. And 1/3 is the stress. It's very high, but it's within the COVID-19. But we have other, it's diversity, is the number. Maybe it's after COVID-19 or before COVID-19. So that is, we see that is important. The main association factor to the mental health among the healthcare workers in Vietnam. First is the work pressure, sure. Prolonged work hours, multiple job role, and high patient workload. Support gap is really stigma surrounding mental health and weak peer support system. We see the report of the other country. The workplace risk. We see the aggression in the workplace, the stress and the occupational exposure to hazardous chemicals. This is the main associated factor. This is a model. They call it the JDR model. Have a job demand, resources, and model. We see the job demand, the work loss, long shift, emotional labor, occupational risk, workplace violence, administrative overload. And the job resource in leadership is peer support, autonomy, recognition, recovery, time, safety, working condition, and confidential mental health report support. This is the formula. If the high demand, but the low, the insufficient resource, that equal distress, burnout, disengagement. That is a very important model. So why did this impact to the system? Mental health decline affects clinical performance, sure. Patient safety and quality of care, workforce retention and health system resilience. And burnout is linked to the lower quality of care, poorer patient safety, lower patient satisfaction. So workforce Instability weaken health system resilient at its cost. Strategic response for Vietnam. First, primary. We need to redesign shape, reduce admin burden, and prevent the workplace violence. The secondary prevention is early screening, peer support, and confidential referral pathway. And tertiary is counseling, psychiatric treatment, and occupational rehabilitation. What should we do? First, we should integrate healthcare worker mental health into workforce strategy. It's not yet, we don't have it. With routine monitoring surveillance system, institutionalize the support within the hospital, not only through the ad hoc project. We need to stable in long-term vinh. Link healthcare worker mental health with the quality of care and patient safety framework, and expand the longitudinal and intervention research, and move from crisis response to long-term proactive system design. And here, we would like to have some cone for the Asian cone. The first, strategic response, primary prevention is a design workload and shift, reduce unnecessary administrative burden, prevent workplace violence, strengthen staffing and recovery opportunity. The secondary prevention is the early screening, structured check-in, peer support system, confidential referral pathway. And tertiary prevention is counseling and treatment, occupational rehabilitation, and safe return to work planning. So, as we said from Thailand colleague, we should have an Asian minimum data set. It's a minimum, it's a simple, so any people can approach. We're not complicated. So we have a data set for our region. Multi-country study. We have JOJ have this multi-country with the Google Doc. It's very important. We can do it. It's not very complicated. Harmonize student, exchange intervention model, and share the regional statement. So today we highly appreciate the Bohol Manifesto already drafted. So we call the Unite the Regional Commitment, uphold the spirit of the Bohol Manifesto. So that is my presentation on behalf of our delegation of Vietnam. Thank you very much for listening.